Oh, hi there. I'm going to continue with my conversation about LPR or silent reflux and how to get rid of it and which doctors you should see and what procedures you might want to go through to find out what's going on inside your throat and your lower esophagus if need be. Mine, I suspected, was because of alcohol. It was just a strong suspicion of mine that that was the culprit of my sore throat. It was pretty obvious. Anyway, I'd asked to see the pictures of the inside of my throat and I guess the inside of my stomach as well from my doctor when I'd had the test done, and she said that she didn't even have access to them. She didn't have access to the specialist tests that they did on me, and I believe her. That sounds like the truth, but she didn't offer the notes that they took down on the procedures, and I didn't know it, but I'm actually allowed to ask for that. That's my personal information. I'm allowed to know what these specialists have said about me. And let me tell you, it would have been helpful a long time ago if I got it, because I had this procedure over a year ago, last April. So this is, it's news to me because they use terms I didn't know the meaning of, and words and things like that. And this is only a few paragraphs long, their notes. It looks pretty standard, but I feel like it does clearly explain certain things. Now, I had two tests done, as I explained in other videos. I had a tube shoved straight down into my throat, into my stomach, where they checked my lower esophageal sphincter, or whatever you call it, the thing that connects your stomach to your esophagus, and that whole area. And I also had the spaghetti tube up my nose and down my throat. I do have the papers, that the notes that they wrote. I finally asked for them and I got them. My doctor did not offer them. I'm not going to show you them because they're confidential, but I'll tell you about them. The doctor's notes are: after consent obtained. I gave him consent. I said it was okay. He went ahead with the procedure. That's true. The back of the throat was sprayed with topical lidocaine. I don't know exactly what that is, but you could Google it and it'll probably tell you. So that's lidocaine. I'll have all these in the tags for this video, all the terms that you might want to know. He was pre-medicated with 3 milligrams of Midazolam for sedation. That was when I was on an IV unit for about half an hour before I had the procedure. So apparently I was sedated. I'm a strapping young man. I didn't feel like I was sedated, that's for sure. It felt like nothing at all. I was pretty sure I was being having nothing put into me, but I guess there was something there. The esophagus and the GE junction were normal. The gastric mucosa was normal throughout. The retroflexed views in the stomach were normal. The scope was advanced through the pylorus into the duodenum, which was normal as well. Gastric biopsies were taken to look for H.Pylori. I hear H. pylori is some sort of bacteria thing, and it's quite easy to get rid of. I guess that's what you have to go through to find out if you have H. pylori. I don't know, but that's what the biopsy was for me. And that's basically when they cut a little bit of the inside of you to test for something wrong or cancer or something. Ryan is a 28-year-old gentleman who had a normal gastroscopy today. Should there be any unexpected findings with his biopsy specimens, I will contact him with a further follow-up. He never contacted me, so I guess there was nothing wrong. That being said, looks like everything went alright. I did notice that the doctor who shoved the tube down into my throat, into my stomach, I forget what they're called, the gastroenterologist or something? I forget, I don't know. Anyway, I noticed on his report that he called me a paranoid schizophrenic who was worried about throat cancer. Now, let me get one thing straight. I was not paranoid about throat cancer. And it wasn't necessary for him to call me a paranoid schizophrenic in his notes. I mean, I do have schizophrenia. I had to tell him what medicine I was taking. I'm taking an antipsychotic. I'm fine. I'm comfortable telling people that. I don't think there's anything wrong with me because of it. But I don't see how that makes me paranoid. I never even mentioned the word cancer to him. He said, "You have a 0% chance of esophageal cancer." And I went, "Okay then, could it be silent reflux?" And he kind of went, didn't really answer me. So, I guess that's just how doctors behave sometimes. So anyway, I'm sure he acted accordingly. I have no complaints about him. Didn't think it was necessary for him to say paranoid schizophrenic in his notes though, but he did. Anyway, on to the next doctor. I believe this one is the ENT, ears, nose, and throat specialist, where they shove the spaghetti tube up your nose, down your throat. Now this is when she started using words that I'd seen before, but I hadn't paid too much attention to. And these words take time to study, but you know, like they're the equivalent of university level words to study. I mean, you can learn them if you just apply yourself to it. They're not that hard. Anyway, what did she say? 28-year-old patient, describes a vague discomfort and tightness pointing to the laryngeal area, has a history of alcohol abuse, has frequent GERD symptoms. I do not have GERD. I do not have heartburn. That's a misleading thing. I have LPR. There's a difference between LPR and GERD. With LPR, you don't always have heartburn. They're more or less the same sort of thing, but they're different, okay? They are. So I would prefer it if my doctors would stop calling it GERD, because it's not GERD, it's LPR. Anyway, yeah, I underwent a test with the other doctor, and he said everything was normal. This doctor is saying I'm denying dysphagia. I'm probably pronouncing that wrong. It'll be in the tag, so you can look that up. That's a difficulty swallowing. I did have a little bit of that. Not really a lot, but a little bit. There's another one called Odynophagia, which is difficulty eating. Or swallowing as well. That was never really too big a thing. I mean, sometimes my LPR felt worse after I ate, but yeah, not really. And there's also Dysphonia, which is trouble speaking. I've never had that. I haven't had a hoarse voice or anything like that. But I'm able to speak perfectly fine. Even when my LPR was at its worst, I was able to speak fine. So that I definitely did not have. The other one was Dyspnea, which is difficulty breathing. I had noticed that I can't run as far or as long as I used to be able to. Like, I can breathe normal if I'm not doing anything, or if I'm just, you know... But as soon as I start getting into cardio, that's when breathing gets difficult. It might just be because I'm a little out of shape. I haven't done that much running since high school. And, you know, I've seen other people who don't have LPR run for the bus, and they're out of breath as much or even worse than me when they get to the bus. Because I've ran for the bus and gone, oh, I'm out of breath. But quite often, with the particular bus I go on to get home, there's always someone running for it. And sometimes they look as though they're not in worse shape than me. They're in better shape than me, and they're still breathing hard when they get on the bus. So maybe that isn't much of a problem. I don't think that is. He is a non-smoker. I don't smoke. Family history is negative for head and neck concerns. Don't know how they know that, but they do. Bilateral otoscopy was normal. Flexible endoscopy showed patient nasal cavities and clear nasopharynx and Fossa of Rosenmuller. What I think that means is it's an area where there could be cancer. That's the most common thing, and it's saying clear. So I obviously didn't have that, or they would have contacted me or said something. It's a bit of a weird sentence. It almost looks grammatically incorrect. But whatever, they're the professionals. Laryngeal exam showed moderate erythema and edema over the postcricoid space and arytenoids. I tried looking up what a postcricoid and an arytenoid, what they look like, and they showed pictures of the inside of the throat, and it's hard to figure out what exactly those things are inside the throat. You have to be a specialist to know that. I am not, so I don't understand. I couldn't interpretate the images, even if my doctor were able to give them to me. They'd be beyond my capability. I couldn't do it. Anyway, erythema is a superficial reddening of the skin. So it's a bit of redness inside my throat. Likely due to dehydration and constant alcohol use. It also comes with dilation of blood capillaries. So that's little veins that are broken. They're not broken, but they say broken, but that's not quite the right term for it. It's just they're irritated. That's all they are. So it's that will go away. And edema is an excess of watery fluids in the cavities and tissues of the body. So I guess that's just my body reacting towards all the alcohol I've been taking. Yeah, so there's that. What else did she say? The valleculae and the pyriform sinuses were clear. Oral cavity, oropharynx, and palpitation of the neck were unremarkable. Now when I hear the word unremarkable, I go, well, what does that mean? Why would they use that? But basically it just means not interesting, nothing's happening there, nothing to be concerned about. That's what it means in the medical world. That there's nothing of concern there. So I'm not discouraged or scared that they use that word. It says cranial nerves 3 through 7 were intact. Sounds good to me. Don't know much about it. Then it goes on about impression and plan. Ryan has endoscopic evidence of laryngeal irritation. I suspect this is due to ongoing alcohol abuse. We discussed ongoing alcohol cessation, so that means me stopping drinking. Duh, that would be the thing that would probably fix it. Some idiot 3 years ago could have told me that, but I wasn't thinking, and I was stubborn, and it just didn't work out that way. This doctor said if my symptoms didn't improve that she wouldn't mind seeing me again 3 months from now, or it would have been 3 months from April last year. So my doctor never recommended that, and I didn't think of it, and I didn't read these notes until now. So I guess I could have seen her again, but My general practitioner, my doctor, didn't feel it was necessary. Felt that it was too slow moving a thing for it to be really a problem. And yeah, so that's some terminology and things that you might want to consider. Again, this is there are many reasons why you can have a sore throat, and mine is because of alcohol abuse. Again, I'm going to put all the major words that you want to know the definitions of in the tags for the video. And actually, can you even see that as a YouTube watcher? I'll put them in the comments. Yeah, tell you what, I'll put them in the comments so that you know which words to look for. Because I'm annoyed. And in indirect way, I let my doctor know that I was annoyed with her because I felt she was giving me the runaround. I accused that of another doctor, not her, but because I didn't want to offend her, because I do really like my doctor, but there's this simple information that they could have told me that would have helped. Like, I was going off in different directions, you know, going around in a circle, trying things out, and they weren't working. I still think the wedge pillow is a good idea. I still think drinking a lot of water is a good idea. In fact, that's what it says in the notes. Frequent hydration throughout the day and anti-reflux measures are recommended. So that's lots of water. That's going to help. I thought because it was inflammation that Advil would help. But I'm told that that's not true, so I gave someone bad advice before because Advil's a mild anti-inflammatory, so I just figured that would help. But actually I'm hearing it increases stomach acid, so that's not going to help. In fact, it will make things worse. I didn't know that, and you know, a little bit of helpful information, you know, is a good thing. I don't see the point in, you know, people not knowing what's going on and acting like babies because they can't figure out how to fix the problem. And giving my history with schizophrenia, even though I don't like that word, I don't like the implications of that word, I don't like the judgment you get by being diagnosed with that. I don't think it's necessarily a bad thing. I mean, it's a funny old world we live in, you know. Anyway, so the point is, this is a few paragraphs long, and it describes basically saying there isn't that much wrong with my throat. Stop drinking, drink plenty of water, stop drinking alcohol, drink plenty of water, and it will go away. And it has mostly gone away for me. There was one of my other doctors who told me to try Claritin. Claritin is an allergy medicine. It sounds strange because, I mean, I don't get allergies that bad. I mean, I sneeze here and there, but that's about it. Anyway, he recommended I take this, so I went, why not? I'll give it a try. And it actually seems to be working. I've been taking it for about 12 days now, and I feel quite a bit better. He told me to if I'm not going to quit drinking, to lower it to as low as possible. So that was pretty solid advice. Because I had noticed that I get a little bit withdrawals when I haven't had a drink in a couple days. 4th or 5th day, I can feel it in my body that I haven't had a drink, and it feels damned uncomfortable. So I've been drinking a lot less lately, but still a little bit. My GP is telling me that she would prefer I didn't drink at all. She's probably right. It's probably a good idea, but that would be difficult for me to do for the first few weeks anyway. So yeah, I recommend having these tests done, and then getting the notes from the specialist, from your GP, because you're entitled to them. You should read these things because they use words that you should know the meaning of, and these are the things they're looking for, so they're the things that you should know, because I didn't know these words before until I read these papers. And yeah, it's gone a long way to my understanding of this whole thing. So anyway, yeah, like I said, there's literally millions of reasons why you could have a sore throat, and I found out the reason why I have a sore throat. I concretely know why it is, and it's because of alcohol. So I'm going to limit, if not completely eliminate, drinking alcohol, and my throat will recover 100%. Because right now it's just irritated with me, it's just annoyed with me, that's all it is. It's not really a big thing. So yeah, all the usual kind of steps. No spicy food, no caffeinated food or drinks, no carbonated drinks. If you're gonna drink alcohol, don't drink cold beer. If you're gonna drink beer, drink it warm. I know that doesn't taste as good, but it's a lot easier on the throat. In fact, you know what would even be better? If you drank flat beer. Now that sounds truly disgusting, but it has the same alcoholic content. Alcohol doesn't lose its percentage in strength because it's flat. It's a myth that it gets weaker. It doesn't. It just tastes disgusting, that's all. But the fact that it won't be carbonated will make sure it's not mildly corrosive going down your throat. It won't bother your throat as much if you're gonna drink. It'd be better if you didn't at all, to be honest. At least for a number of months anyway, as I've said before. So this is overall good news. Yeah, I'm gonna keep a copy of these for my records. And I hope you guys have a good day. See you later.